Now I'd like to introduce Lauren Gibson up to the stage. Lauren is one of Jenny's many excellent PhD students, but she's got many fantastic students, both current and past. And Lauren is doing her research topic on exploring the potential role of CMOs and peer workers in delivering chronic disease prevention care to people with mental health conditions, which I think is an excellent area to be covering, because that's what I want to see. I want to see much more peer work and peer navigation in this area. I think it's really important. And she has that particular interest in really exploring that unique role of peer workers and what they can add in here. So I'll let you take the stage.
Is that good? Yeah. So I'd like to start by making a few acknowledgements. Firstly, to the traditional owners of the land we're meeting on today, and paying my respects to elders past, present and emerging. I'd also like to acknowledge my co-authors who are listed on the slide there, and particularly thank Dr. Julia Dre for her contribution to this study. And then secondly, I'll get to that later. The title of the presentation. So today I'll be talking you through a qualitative investigation of support provided by community managed organisations to address chronic disease risk behaviours among consumers with mental illness. So I'd like to thank the Prevention Centre for providing funding for this research through their Boosting Preventive Health research program, and just acknowledge their partners. So I'll start by providing a brief background that's going to sound very similar to Jenny's. But we all know people living with mental health conditions experience a significantly reduced life expectancy, with various different estimates as to what the amount of years that reduction in life expectancy is, but one kind of global estimate is a median of 10 years of potential life lost. We also know that the majority of this reduced life expectancy is due to a higher prevalence of physical health conditions, such as cardiovascular disease, and some of the largest contributors to those physical health conditions are health behaviours, such as tobacco smoking, poor nutrition, harmful alcohol consumption, physical inactivity, and poor sleep. Therefore, supporting people to make positive changes to these health behaviours is a promising strategy to improving the life expectancy for people living with mental health conditions. Community managed organisations, otherwise referred to as CMOs, that support people living with mental health conditions offer an important setting in which these health behaviours can be addressed. So as Jenny was talking about, these organisations are non-government organisations that, rather than focusing on the assessment, diagnosis and treatment of mental health conditions, they have a broader focus of improving overall well-being through providing support and assistance. So given this focus on improving overall well-being, CMOs have been suggested to be an important setting in which to provide some health behaviour support. So, there hasn't been a lot of research that then looks at how often this health behaviour support's being provided or what this support looks like. So the aim of this study was to explore the types of health behaviour support that's provided by community managed organisations. So where Jenny was talking about kind of the level of care or support provision that was occurring, this is really about further unpacking what that support looks like in practice. And then the second aim of the study was to assess perceived organisational and staff level barriers and facilitators to organisations providing that support. So to address these aims, we conducted one-on-one semi-structured telephone interviews with 12 members of senior management representing 12 different CMOs in New South Wales, Australia. After we had the audio files transcribed, we had 3 independent coners analyse the transcribed interviews in pairs, and they conducted inductive thematic analysis to guide theme generation. So I'll just talk through our results now. So when I'm talking about health behaviours, I am referring to those 5 kind of ones I outlined at the start, being smoking, nutrition, alcohol consumption, physical inactivity, and poor sleep. So I don't know if you can see that very well, but we categorised our themes in terms of the types of health behaviour support provided. So you can see these fell into practical education and life skills, referral pathways and local connections, and staff encouragement and peer support. And then looking at the barriers and facilitators to health support provision, there's 2 barriers that were most salient, which were lack of funding and a perceived limited ability to influence behaviours. And then 3 facilitators, which were a supportive workplace culture, collaboration with available supports, and staff training and education. So I'm going to talk through each of those in a little bit more detail now. So starting with the types of health behaviour support provided. So the first kind of key type of support was really focused on providing practical supports that promoted takeaway life skills among consumers accessing community managed organisation services. So this looked like educational resources such as websites, pamphlets and information sessions, and also practical supports like providing nicotine replacement therapy for smoking cessation, teaching nutrition skills like label reading, meal planning, cooking meals, and exercise activities like walking groups and group fitness activities. And I've just included a quote up there, and there's a few throughout the presentation. This one's about a particular service developing cookbooks and resources to help people cook healthy meals. The next type of health behaviour support that was highlighted as important was referral pathways and local connections. So this could be to health professionals in the local area, such as general practitioners, dietitians, nutritionists, alcohol and drug services, counsellors, exercise physiologists and personal trainers, as well as other services such as the New South Wales telephone quitline service for smoking cessation and food providers such as Meals on Wheels. And the quote up there is just exemplifying a good experience one of the leaders had with a local group exercise service where they were offered a free personal trainer to help guide consumers through some physical activity. And then the last type of health behaviour support discussed was around staff encouragement and peer support. And staff encouragement was discussed largely in relation to physical activity, where it was focused on motivating consumers to engage with physical activity, ways to integrate it in their day-to-day activities. It was also discussed for other health behaviours, such as encouraging consumers to engage with health professionals, such as GPs, to discuss smoking cessation, or engaging with cooking and shopping activities available to them. And then peer support was also highlighted as important. One particular example that was provided was a telephone coaching service where a peer health coach was assisting consumers to make reductions or quitting smoking. And a quote up there that I think exemplifies the approach taken was, "I understand where you've been and I'm here to do this with you," which I thought was quite a nice way of explaining that process. And we know community managed organisations have a high proportion of peer workers, so it's promising to see that this is coming up in the health behaviour support space as well. In terms of barriers, there was 2 kind of key barriers that were identified. The first around a perceived limited ability to influence behaviours. So this was noted for certain health behaviours over others, so for things like sleep, some CMO leaders didn't feel they were doing as much compared to other things such as physical activity and nutrition, for example. And also for smoking cessation in some cases, and for alcohol consumption, sometimes it was linking in with other services where they thought they could have a better impact on helping consumers work on those health behaviours. But that limited ability, or a perceived limited ability, I guess, was sometimes dependent on how each organisation was structured or the type of support they provided. So services that had staffed residential services sometimes felt they had more opportunity to work with consumers on their health behaviours, particularly for things like sleep, where they could, observe sleeping patterns or bring that up more regularly, compared to other services that might have a 2-hour drop-in service where they felt they had less ability to work on those behaviours with consumers. And then probably the most salient barrier that all organisational leaders noted was a lack of funding, and describing the funding as limited, inconsistent and inflexible. And I think this quote exemplifies what a lot of leaders spoke about, which was even though there was an absence of funding, they're still engaging in this work because it's so important. But in order to have a sustained approach, we really need that targeted, ongoing, stable funding for health behaviour support. It was also noted that in regional areas, this was even more limited, and, having inflexibility in the types of support staff that could be hired, such as nutritionists or dietitians. Not having allowance for that in funding arrangements was a limitation. And then facilitators, to end on a slightly nicer note. So the first facilitator noted was a supportive workplace policy and culture, workplace policies and culture. And so this was talked about in relation to upper management staff promoting health behaviours, and that could be through workplace initiatives. So one organisation noted staff were given a longer lunch break if they included a walk within that lunch break. And then, policies and a culture that focused on having those positive health behaviours among staff. Organisational leaders felt that translated to them, that those health behaviours then being a priority for those staff and maybe being more likely to bring them up with consumers. The second facilitator was around collaboration with available supports, so engaging with the local community and existing services that existed. And that was to share knowledge, share resources and expertise. It could be linking in for training that was available, upskilling support staff, or getting local allied health professionals to come and do talks at the local service, those types of things. And lastly, staff education and training. So all organisational leaders highlighted the importance of staff receiving targeted training for health behaviours and ensuring staff were taught how to tailor the support provided to each individual consumer. That was highlighted as important. So the study has a few limitations that we need to consider when interpreting results. So we had about 12 CMO leaders participate out of about 85 we invited. So this might not be representative of the entire CMO sector within New South Wales and the types of health behaviour support that's provided. However, we did get a large number of kind of multi-state organisations that have a large number of staff and consumers, so still a good sample. Level of informants, so we were speaking to people who were in senior management roles, and some of them would have, managerial roles as well where they're dealing with staff and consumers, but others didn't. So we still need the perspectives of staff who are providing direct support and consumers to get that fully rounded picture. And COVID-19. So when we spoke to organisational leaders, we asked them to reflect on their usual practices and kind of not about the changes that were being made to adapt to COVID. So although we did ask them to respond that way, there is a chance that the responses were slightly different due to COVID. So in conclusion, this study provides an in-depth exploration of the type of support provided by community-managed organisations to support people with their health behaviours, and identified a range of barriers and enablers to providing that health behaviour support. We found that CMOs are well placed to embed health behaviour support for consumers living with mental health conditions, and they appear to have organisational cultures that are highly supportive of providing this type of support. However, it appears to be variable across health behaviours, so some health behaviours like physical activity and nutrition may be addressed more commonly than other behaviours like tobacco, smoking, alcohol consumption and sleep, for example. And this support also seems to be hindered by funding, so that could be whether or not health behaviour support's included in someone's NDIS plan or can be reported on for a certain funding arrangement that the organisation has. Priorities for increasing the delivery of health behaviour support might include continuous and consistent funding, specifically for health behaviour support, to have that sustained and ongoing support available to consumers, staff education and training, and more research that focuses on the perspectives of staff working directly with consumers and consumers themselves to highlight what they would like in terms of receiving support for their health behaviours. And that's all. I'd like to say thank you to the CMO Connect research team and all of the members of senior management that participated in the study. Thank you. Thank you.
Don't run away though, because we've got time for a couple of questions for you, either yourself or Jenny. Jenny's going to try and hide down there, but if you've got a question specific to Jenny, we'll get her up here. Has anyone got any questions about the Simo stuff? Yes. I think there's a microphone coming, if you can just be patient so the people online can hear your question.
Thank you. I just want to ask, in terms of the funding, I know probably they don't have extra funding to provide to the support worker. And when you discuss with the 12 CEO, whether they have mentioned about they will include this type of training in the induction section when they just recruit the support worker, not just under the line, or probably when they are receiving their training before they can become a support worker. Is it including this type of training with the mental health support worker or the lifestyle changing? Thank you.
So the question is around whether kind of that health behaviour support training is included before, like in the mental health workers' previous training before entering the community managed organisation. Yeah, that's a very good question, and I don't know if I have the answer to that. It's something I've been thinking about lately in terms of where that staff training is maybe best placed to be provided, whether it is in like a TAFE setting where that's provided to all people who are training to be mental health workers, whether it's by peak organisations like the Mental Health Coordinating Council who can provide that, or whether it's within each organisation or service so it can be locally tailored and adapted to what's available in each area. So that's a great question and one I don't have a clear answer for, sorry.